In your work on MERS, what were the most memorable high points?
Well, I think Middle East respiratory syndrome is an illness caused by MERS coronavirus, which has a very high mortality rate and causes severe disease and presents tremendous challenges to the countries of the region here. I think looking back, since its recognition in 2012, then with just huge catastrophic outbreaks, particularly in 2014 and 2015. I think there have been a lot of positive developments since then, particularly in 16 and 17 and now in 18. I think we've seen less healthcare facility transmission, and this is because of more rapid identification of cases presenting to emergency rooms, really early detection, early implementation of infection control, and just a lot of testing and contact tracing, contact investigation, which has really led to a real decrease in the amount of healthcare facility transmission. And you see that by looking at the epidemic curve. And I think the countries in the region are doing a great job of really getting the word out to the facilities, preparing facilities, rapid response teams. So I think the positive thing over the last couple of years has certainly been a real improvement in the way that MERS-CoV is being recognized and managed.
In your opinion, what are the main reasons that MERS cases are sometimes misdiagnosed in emergency rooms of hospitals, leading to multiple chains of transmission?
It's a good question. I think to answer that, you really have to put it in perspective of the region here. In this region, particularly in countries in the Arabian Peninsula, there is active circulation of MERS coronavirus in the camel populations, with occasional spillover events into human populations, and then unfortunately introduction of those cases into healthcare facilities, with just the ongoing challenge of being able to detect these cases early and to suspect them of MERS coronavirus and implement the proper infection control and testing following that. So these, as I mentioned, I think there have been great improvements over the last couple of years in how this potential is managed. But these systems are run by humans, and there will be occasional situations where there is healthcare facility transmission. Fortunately, in the last couple of years, we've seen much less of that. And this is in sort of contradistinction to other countries outside of the region where, for example, in the U.S., where I'm from, we can focus on returning travelers from the Arabian Peninsula who are ill, who present to healthcare facilities, a much, much smaller group of people to focus on. But here in the region, certainly any community-acquired pneumonia has to be suspected of MERS coronavirus, presenting enormous challenges.
Why is it important for the CDC, the WHO Eastern Mediterranean Regional Office, and other international agencies to work hand in hand to improve preparedness and readiness for MERS?
Well, MERS is a global public health risk. It certainly occurs in the region, but presents a global risk, and it has to be approached globally. And MERS has a way of reminding us of that, particularly in 2015 with the imported case to Korea. And so I think to meet this challenge certainly will require all the countries of the region, IMRO, WHO, CDC, other international partners to address this on a global scale.